Class is in session. Today we're going to be talking about lithium. I made a previous video before, but now I'm redoing it nice and neat. So lithium is a mood stabilizer, and it's the gold standard for bipolar disorder. So if you're getting ready to take your Psych and P boards, remember that lithium is the gold standard for bipolar disorder, okay? It's also neuroprotective and also has anti-suicidal properties. So if you have a case presenting where your patient has a suicidal ideation and bipolar disorder, think lithium, okay? Because it's the only one that has that anti-suicidal properties. All right, so when your patient's taking lithium, we want to make sure that we tell them to avoid the AND, ACE inhibitors, NSAIDs, and diuretics, specifically thiazides, when they're taking lithium because they reduce the renal clearance, okay? Lithium is excreted from the kidneys, so taking these medications with it, it's going to risk for lithium toxicity because it builds up, okay? Because these reduce the renal clearance. So now your lithium is building up. Your normal range for board purposes, 0.6 to 1.2, toxic at levels greater than 1.5. Signs of toxicity, severe GI symptoms, confusion, slurred speech, coarse hand tremors, seizures, ataxia, trouble walking. Before starting anybody on lithium, you want to check their pregnancy status because there's a birth defect called Epstein's anomaly that with the baby's heart that can happen if a pregnant woman starts lithium. Thyroid, make sure you're checking thyroid hormone because lithium can cause hypothyroidism, okay? And also hyperthyroidism can look like mania, which is in bipolar, so you want to make sure you rule that out as well. But specifically that lithium can cause hypothyroidism. You want to check kidney function since it is excreted by the kidneys. We're checking for that renal impairment. EKG, it causes T-wave inversions. It can cause T-wave inversions, so you want to get a baseline EKG. Also for boards, know that it can cause leukocytosis and diabetes insipidus. Make sure that your patients are staying hydrated so that that lithium doesn't build up in their system as well. Okay, we want to watch for that toxicity. Monitoring. So this is one that you probably won't get asked about on boards because it kind of is different in different resources. This is actually Stahl's guideline, but if you look online, it might be a little bit different. But in general, once you start lithium, you want to check 5 to 7 days after starting the dose, okay? And then according to Stahl's guidelines, then every 2 to 3 months for 6 months, and then every 6 to 12 months if stable. Usually I do mine like every 3 months if they're not stable. And then you want to check that level at 12 hours after your last dose, okay? So this is just a brief summary of lithium, which is the gold standard for bipolar disorder.